Today I would like to tell you about LipoSMART system. This is autologous microfragmented adipose tissue system. We use this system for patients that have various joint pains. It can be due to degenerative diseases such as osteoarthritis or due to some kind of cartilage injuries. Joint pains, for example, due to first or second or third degree of osteoarthritis, they are suitable for this procedure. It can be used for the patient that had previously arthroscopic surgeries, or we can use for the patient that already tried other injections, for example PRP or steroid or hyaluronic acid injection, and did not have the results that they were hoping for. The goal of this procedure for the patient is to alleviate pain, improve range of motion, improve joint movement and strength. With this treatment, we try to help patients to live a better life. I would like to express that the goal of this treatment is to postpone further surgeries for a long time as possible. During this procedure, we take adipose or fatty tissue from the abdomen, from the thighs, or from the lower back. It is done during anesthesia. Once we harvest adipose tissue, we use LipoSMART system to prepare mesenchymal and stroma cells for the further injection to the joints. We can inject it to the knees, hips and other places in the body. In this clinic we work with plastic surgeons. They harvest adipose tissue. For example, they perform liposuctions. Most of the fat tissue is discarded. This is the goal of this combined procedure together with liposuction, that the unused adipose tissue can be prepared with a LipoSMART system and later injection to the hips, knees or other places in the body that are affected. The good thing is that the patient will have less pain because everything is done under the same anesthesia.
So what is liposuction? Liposuction is a procedure during which we make a few small incisions, a few areas, and with specialized canals we remove a certain amount of fatty tissue. What patients can get a liposuction? So most of the time that's a patient that doesn't have a lot of excessive fatty tissue, but wants to remove or contour your body. So in those cases, we can do through small incisions a liposuction, remove a certain percentage of your fatty tissue. When we do a liposuction, it is most often combined with fat transfers to breasts, buttocks, or let's say hip dips. We can combine this operation with our orthopedic surgeons who inject that fatty tissue into our joints.
Overall, I believe it's a good thing to have two procedures under one anesthesia because it's less pain for the patient, saves patient time, and it costs less.